Steph. Hey, Marissa. Welcome to Atrium Afterhours.
Hey, thanks for having me.
Of course.
It's after hours.
It is.
I never use the mic. I put it down here. I forget that I have it.
So we all had a long day of work today?
We did.
Yeah. Well, I'm going to let Marissa introduce herself a little bit, and then we're going to get to asking some questions.
Okay.
I'm Marissa. I'm a physician assistant. I graduated in 2021 from the University of Mount Union with my master's in physician assistant studies. I worked in outpatient psychiatry for about a year and a half before coming to Atrium, and now working and doing gynecologic exams, obstetrical care here with patients. So I've been here for almost 3 years. Can't believe it.
I can't believe it either. And also,
You didn't know I worked in psych.
yeah, I want to know.
Yeah.
Have you been analyzing me?
Probably. I'm analyzing everyone.
She's like, and you are crazy. Okay.
We were talking about being crazy downstairs all day. We were talking about getting off birth control and stuff because we have some girls downstairs that are feeling like crazy today and where we are in our cycles.
Oh, yeah. Okay.
We were all talking about it.
Right. And people are feeling like they want to get pregnant.
People are feeling like that, and people are feeling like they want a divorce sometimes.
Oh, no.
Not actually, but, you know.
Yeah,
like
gotcha.
breathing's bothering her. Her husband breathing is bothering her.
Well, sometimes that is too much.
Yeah. So, I don't know. So she said she's going to crawl out of her skin today.
Oh, no. Okay, so maybe we need to have Marissa come on at a different time. Today our topic was going to be Pap test, HPV, like all the things like woman care. Because that's a lot of what you're doing during the day, in addition to many other things. And also, clearly, you are like psychoanalyzing people. No, it's great though, because what a great background for things like that.
Yeah.
For like, you know, sometimes you get women come in and they're just like crying because their husband was breathing.
And also postpartum depression is such a big thing.
Yes.
So it's nice to be familiar with medications and know how to use them for that as well. So it's been very helpful. There's always people who need help, even if you don't have a diagnosed mental condition that you have. Like, it's nice to be able to talk to someone that kind of knows that side of things too. Mm-hmm.
Yes. And now you're in trouble because I feel like I need a lot of help. Always.
Okay.
She's like, oh God.
What did I get myself into?
So the reason Hayden and I started this podcast, you know, Hayden's our social media director, and I'm getting there. I'm all different things. I'm kind of in limbo right now. I was bored, so I thought maybe I'd do a podcast and we'd talk about women's health stuff. So we really want to educate people, women and families, even men. My husband listens, because I force him to. We want to educate people on all different things, from just like aesthetic stuff, skincare, weight loss, just like how hard it is to be like a mom, go to work, or even if you don't go to work, you know, breastfeeding and childcare, and then, you know, all the women's health issues and all the things surrounding women's health, from OB and labor and delivery to menopause. So that's why we started this, and we want it to be fun and light, and we want to talk about real life stuff, down to earth. But we want to talk about real things too, and explain things from a professional level and from people who have that education that are performing these exams and what we're doing the exams. So
should we have her explain what a Pap test looks like first?
Yeah.
Okay.
Let's talk about it.
So I think a huge misconception that a lot of my patients come in with is when you have a pelvic exam, that's what a Pap test is.
Yes.
And that's not what it is. A pelvic exam is a way to look at the cervix. It's a way to look inside at the vaginal walls and to see if there are any abnormalities there. You can feel the uterus. You can feel for ovaries to see if there's anything. That's not what the Pap test is. The Pap test is a cervical cancer screening test. That's the little brush and maybe the spatula that you've seen on the side table when you're trying not to look around and look up at the ceiling and just hope that it's over. So we use the Pap or the pelvic exam to get to the cervix so we can do the Pap. Like I said, it's a cervical cancer screening test. Depending on your age, we do it at different amounts of time. But it tests for cervical changes that could lead to cervical cancer. That's another thing I like to emphasize with my patients is most people in the United States should not be getting cervical cancer.
Correct.
Because we have such great testing. You know, in third world countries where people don't have access to care, like it's a lot different. But here, there are doctors or people available to help get you Pap testing done at regular screening intervals so that we can prevent the acceleration of cervical change to get to that point. We can stop it in its tracks.
Right. And I did learn that firsthand when, I went to Guatemala and was in a very rural community doing, they don't have cytology. They didn't have access to microscopes. And we collect a little sample of cervical cells, we send them off to the lab, and then the lab comes back and they say, okay, this, and this, everything's fine, or we have some abnormal cells, or we have a certain type of HPV. They don't have that there where they live. They can't afford it. They don't have access. It's so eye-opening. So instead of doing the Pap test, we were doing kind of the same exam with a speculum. And then you look with the speculum, put an acetic acid solution onto the cervix, look with a light, and then you could just visually see if there were any cervical changes. And if you saw dysplasia or abnormal cells, we just took a little, kind of like a cauterizing tool, and we just burned their little cervixes off. Not off, but like 4 millimeters deep. Like, ouchie. Yeah. So we know here in America, we're so lucky, we're so blessed that, you have access to healthcare insurance, you have access to healthcare, and even people that don't have insurance still have access to healthcare because there's clinics, there's places you can go to get your routine screenings and your tests. So they come in and they have a speculum exam, and we have our fancy light that's hooked onto our table that's clean and sterile, and we clean it, and everything's, we follow all these standards, and you put that speculum in, grab a couple cells off the cervix, and then send it out. And then the other part is just, the manual exam where we're feeling the uterus, feeling ovaries, just to make sure nothing's wrong. We also have access to ultrasound. We have patients come in here, if something's wrong, pregnant, not pregnant, whatever, we have ultrasound right down the hall. Yeah. So these people in Guatemala, we didn't have that. So we kind of were like doing our very best diagnosing and then treating the very best we could, because they might go another 2, 5, 10 years before they're seeing a provider.
Yeah, I have another question.
Yeah.
So going into my first appointment, should I be nervous? What will that look like? Just kind of go through like the nervousness part of it, and what the first appointment looks like and everything, and how to not be nervous. Yeah.
I don't know if you can not be nervous.
Say, you can't not.
When I work here, it's like, do you know how many people you guys see a day? It's like, it's okay. They've seen a vagina before.
Right.
But it's not about me.
Yeah.
It's about you. Yeah. It's about you. It's about whoever's in the chair, It's not about me. You have to understand, I guess, as a provider, like, that might be their first time. They've never been there before, and you have to just be cognizant of that and have some empathy because, at least if you're a woman, you've done it before. We've all done it, so we kind of know how it feels. It's nerve-wracking. Yeah. Someone's looking at you down there that you don't normally have people look at you, so it's nerve-wracking. Right. But I think you're in good hands. I think knowing like someone is going to take really good care of you is a good thing to like put in your mind. Like, you're doing this so that you can help yourself and make sure that you're healthy and safe. But for the first appointment, if you're 21 is usually when we start Pap testing. And at that point, you have like the speculum exam, and they will do like the little test on the cervix and take the little sample of cells. You shouldn't expect any pain. Well, you have some discomfort, of course. Yeah. The speculum has to go into the vagina to look at the cervix, and it has to open up so that we can have visualization. So will be mostly pressure.
Mhm.
It shouldn't be very painful. And then when we take the little sample, I have patients who some don't even feel anything at all. Some feel like a little twinge or a pinch,
Yeah.
but normally it's very quick.
Mhm.
Don't
It's
expect,
like
everyone thinks that
Yeah.
they're going to be in the stirrups for like 10 minutes.
Yeah.
And then I'm like, oh, I'm done. And they're like, oh, and I'm like,
Did you
yeah,
really
that's
do
it.
that?
Yeah. So it's a nice feeling.
Yeah.
Right. So and then another important thing to note is, under 26, we're doing STI screenings.
Mhm.
So, if you're sexually active, you should be getting screening. So a
I
lot of
mean, no matter if you are with one person or not, it's always if
Yes.
you're already here, just do it,
well,
kind of thing.
yes, and up until 21, you don't need a Pap test.
Yeah.
But if you're sexually active and then you need to come in, and then we need to do an exam with that speculum, and then just a Q-tip, collect some cells, send it off, make sure like we can test for like gonorrhea, chlamydia, yeast, trichomonas, things like that.
What is that?
All different STIs. All different
What is
STIs.
trichomonas? What is that?
Well, it's not good.
What is it?
It's just an STI.
Okay.
Um,
I've never heard of that one.
Look at us already teaching people,
I was
Marissa.
like, what is that?
it's just a bacteria that can be
Oh,
treated with an
okay.
antibiotic.
Okay.
Yeah. It's just another one of,
Many.
yeah.
Mhm.
Okay.
It's
Mhm.
yes. So
Don't be afraid. It's not a new strain out there.
no, we're just, and then we get a chance to like look at, like, visualize external genitalia, make sure there's no sores, lesions, anything going on down there. And also at your well woman, that's the time that, we're asking you, are you having pain with intercourse? Are you safe in your relationship? How are things going?
Mhm.
Just like we're going to do, just a breast exam.
Mhm.
We're going to do that pelvic exam. If you're under 21 and sexually active, we'll go ahead and do that STI testing. And then we can always add on. We can't tell if you have HIV or syphilis from the little Q-tip
Mhm.
test, but we could always do blood work.
Yeah. Okay. Another question for you. You're a mom, right? Tell me a little bit about working and being a mom.
Before I like started working when I was still in school, I would have said that was like the hardest thing I've ever done in my life. Like just going to school, studying all day, studying all night, just preparing to become a physician assistant. But really, when I became a mom, I realized like this is the hardest job I've ever had in my life, but it's the most rewarding job I've ever had.
Yes.
I love that I'm so lucky. I get to come here and work and be supported by my coworkers and get to do something that I love. And then I get to go home and spend time with my daughter and my husband and like have my family as well. So, it's a balancing act. It's not easy.
No.
I'm tired. I was
Mhm.
more tired when I was in my early postpartum days, trying to come to work, not getting a lot of sleep. But, every day is different, but I do love to be able to have this balance, and it reminds me like who I am,
Yeah.
and not just like Marissa the mom now. Marissa's still like who she is. She's
Yeah.
a physician assistant.
Yeah.
She has her like job and like
Yeah.
career too, which
Yeah.
I really like because I
Yeah.
think that can be inspiring, especially for my daughter growing up, like knowing like you can do it
Yeah.
and like you can do other
Sure.
things and not you can do anything you want. So
Of
I think
course.
that's nice.
And it's nice for the patients too, because as a mom, and you can talk about that postpartum period, pregnancy woes, because there's a lot. Breastfeeding, pumping, up at night with colicky babies or sick babies or whatever the case may be, childcare issues, and trying to be a professional and be at work, and because we have responsibilities, and even though we're moms, we have to get up, we have to come to work, and sometimes we're tired, and sometimes our kids are sick, and sometimes we're sick.
Yeah. Yeah, for sure. Well, do you have any other questions for her?
Anything else about the well woman? We gotta talk about HPV. We haven't even touched on
I think
it.
we need to talk about just like screening guidelines in general.
Yes.
Like
Mhm.
how often should you be getting a Pap test, stuff like that. The guidelines state like the minimum requirement,
Yes.
I think. So, I think you had that. Do you have that on top of your head? I know after 30, everyone needs a Pap and HPV together at least every 5 years. That's the
Yes.
minimum. Before 30, you can do Pap cytology only every 3 years.
Every
I
three-
don't follow the guidelines,
No.
so
And I feel like no one does.
Mhm,
And
no one.
so for me, as a nurse practitioner
Mhm,
student,
mhm,
I read the guidelines,
mhm.
and then
You have to know them for your test.
Yeah.
Yes,
We're all doing the Pap test and the HPV testing more frequently because we don't like to wait so long in
Right.
between.
Yeah.
We don't
doesn't
want to
hurt
wait
anything.
5
Yeah.
years
Yeah.
before we do another Pap test
Right.
because a lot can happen in 5 years.
Sure.
And we want to make sure people are taken care of. And I think you could cue and question all of the providers in this practice, and everyone would tell you that they're doing it a little bit differently.
Well,
which
I
is
know
funny.
that for a fact
Yes.
because
You've seen it firsthand.
Yes, doing rotations mostly with our
Mhm.
nurse practitioner Jewel,
Mhm.
a little bit with you,
Yeah.
a little bit with honestly everybody here, but they all have their different way of going about
Mhm.
things. All correct,
Mhm.
all evidence based, all based on individual patient needs, but they have some different ideas in their mind, like
How they want to do things.
I don't want to wait 5 years. I'm going to just go ahead and Pap her because why? What does it hurt?
Yeah.
But then, so the other thing that they're looking for on that Pap is that human papilloma virus, the HPV. And I know that most people have heard that term.
And I think people are scared of that term because I think of it as like gonorrhea, chlamydia. It has this really negative connotation with it, like I'm dirty or something's wrong with me. And not a lot of people know that like a huge portion of the population in the United States has been exposed to HPV. Many people who have been sexually active have been exposed. So it's not uncommon to have that exposure, but what we want to make sure is that HPV isn't causing cervical changes if it does pop up. Once you've been exposed to HPV, it can clear off of your cervix, so meaning your immune system can clear it off. It's a virus, so you don't use any antibiotics. Your body's immune system can just naturally get rid of it. But once you've been exposed, it's always kind of present in your body because it's that virus. So sometimes later on in life, it can pop up again. That's why we do testing for it, because if it's gone for 20 years, but then it pops up again, we need to make sure it's not causing changes. That's another crazy thing about it is we never really know when you've been exposed. So some people get really nervous if they've got it, they get it popped up at like 50 and they've been, in a monogamous relationship for the last 20 years and they're really nervous that they've had some infidelity. And I always try to reassure people that this could have been present for like forever.
Yeah.
And
Right.
it just is not, it's just been laying dormant.
Yeah.
And now for some reason it wants to reactivate. Did your immune system weaken? Did you have a lot of stress? I mean, we all have stress in our lives. So it could be something like that. But we just check that because we know that HPV could lead to cervical changes that could lead to cervical cancer.
Right. And not all HPV are the scary ones. There's a
Mhm.
few strains that are high risk. And those are the ones we specifically like, if somebody comes back with one of the high risk HPV positive, then we have to have a conversation depending on their age. What next? Do we take a look? Do we give them 6 months? Do we give them 12 months? And then we retest. It just depends on their age, their lifestyle. And then if they have a history of a positive HPV and then it's cleared, and things like, smoking
That puts you more
can
at risk for reactivation of
Yeah.
the virus or prolonging for the virus to like clear off of your cervix.
So young, healthy women might have a positive HPV as long as it's not the high risk kind. Usually we'll just kind of let, their body their immune system take care of it.
And I think the biggest thing, because we can't talk about every scenario on here,
No.
right?
There's so many.
There's a million scenarios. And I think the biggest thing is if something happens and you're worried about it, you get a positive HPV, you get a change on your cervix, someone calls you and tells you, hey, this is what happened. If you're really nervous, don't be afraid to ask questions. We're here to help you. We have people here to help you, nurses, people that are educated on these types of things. Don't be afraid to make an extra appointment with your provider to ask them more questions about it because it can be nerve-wracking and it can be scary and we can go down the dark web of the hole of WebMD and everything else and Google AI telling me I have cancer and like everything else. So don't be afraid to ask questions and to really get clarification because everyone is going to have a different scenario, and
Sure.
I can't tell you every scenario
No.
that we're going to
No.
do something for it.
Yeah.
But sometimes we'll take a look at those results and we'll think, hey, we need to take a little bit closer of a look. So then we can you want to talk about like colposcopy?
So colposcopy is more like a diagnostic procedure. The PAP is the screening. So it gives us more of a confirmatory diagnosis of what we have going on, a closer look. It's very similar to a PAP test in the sense of you're in the stirrups, the speculum is placed. Then what the providers do is they use like a vinegar solution that goes on the cervix, and it makes any abnormal cells change white. And it makes it easier for the provider to see. They can look through the colposcope, which gives them like a better view of everything. And if they see little areas, like around the transformation zone is what we call it, if they're whitened areas that they need to take a teeny little biopsy, they can use like little forceps or tweezers and they can take a little sampling of cells. Those can go off to the lab for the pathologist to look at and let us know what is there. Is there something there? Sometimes providers even will just do random biopsies if there's no whitened areas because they want to make sure everything's okay. But it's more of like the confirmatory. Is it painful? Of course, everyone's going to ask that. It's uncomfortable. No, nothing feels great. And I think it's important to know everyone has a different pain tolerance.
Yes.
Everyone tolerates things differently. And, some people might have more trouble than others. Sometimes we can do like local anesthetics and things to help with that pain. And I think it's just important to talk with your doctor and to talk about that. But usually we bring in people if they've had their first abnormal and they need a colposcopy to talk further about it so that they can feel more at ease going into the procedure.
And the colposcopy, I mean, honestly, it's in a different room, which can be scary, but and it has this very archaic looking machine. It's just goggles essentially, and you're in the stirrups, speculum, and then they put the vinegar solution on and they look with the goggles that gives them just a much, much better view. So really the same speculum exam, they're just looking at your cervix like with a little microscope essentially. And then yes, if they do need to take a little sample, that could be pinchy or crampy for a minute. For a minute.
And then you're back to the rest of your day. You don't have to have a driver. You don't have to go under general anesthesia. You can just go back about your day.
And then they'll send that off. And then if those cells do come back and they're, dysplasia or precancer or something like that, then the patients can get scheduled for, like a LEEP excision. And we can talk about that too, because I think that people also think, if they've had a LEEP, they'll say, well, I had cervical cancer surgery. Well,
maybe not.
Yeah.
And it's just even more of a closer look. And it can help do the treatment for something that we are more concerned about, a higher grade change that could be, closer on the scale of getting towards the cervical cancer diagnosis. And we kind of want to stop that in its tracks by taking away the cells that are doing the bad stuff. Does that make sense? Sometimes people describe it almost as like a shave.
So it's like a little loop, and it's like electrified. And
scary to think about
you are kind of twilighted for this. They give you some meds and stuff, but then they just like kind of
local anesthetic
shave off those bad cells. And you are medicated, and you can have a ride home, and then you can lay on the couch and you can take a couple days off. But that doesn't mean that you had cancer. That's also going to get sent out. And then it'll come back, and then you'll come back in and you'll talk to your provider about what your results were and then next steps. And then they'll kind of say to you, okay, we're going to do your PAP every year from now on. Or you know what? We're going to do your PAP every 6 months. And just to make sure.
Okay. Makes sense.
Yeah. So things like a LEEP, any surgical procedure to your cervix, always important to let your provider know if you're going to become pregnant, or if you have a new provider or whatever. If you are pregnant, we always want to know that too. So that's just important. And I think that the more educated patients can be, know what happened at your appointment. And if you don't know, ask.
Yeah.
Yeah.
That's what I was going to say, is that you can make an appointment to not be in the stirrups, but to just have a conversation with your provider as well.
Of course.
If you have any question at all.
Yeah. Mental health.
Yeah.
Like, postpartum depression, birth control, of course, STIs, safety, things like that.
Or like, if this hurts, well, that's not normal. Let's ask.
Yes.
Yeah.
Yes. When you come to your yearly, that is the time to say, hey, what am I doing for birth control? Am I planning a pregnancy? What, you're in those stirrups, you could be like, hey, Marissa, what are you doing down there?
Yeah. Yeah.
What kind of tools you got going on today, Marissa?
Yeah.
You just got a little spatula there, a little brush, or what you doing?
Yeah.
What you doing down there? You got a Q-tip? Show me what you got. So that's fine to ask. And I think we're all very open to say, hey, I a lot of times, especially with the younger population, I'll show them the speculum.
Yeah.
I'll hold it up and be like, this is what it is.
Yeah.
This is what it's going to do.
Yeah.
And are you ready?
Yeah.
And if at any time it's too much, we can stop, we can slow down, like any of that. Yeah.
Yeah. All right. Well, do you have anything else to add?
No. Do you have anything else?
I think that was good.
Yeah,
Good
I love it. So
information.
everybody come get your yearly exam.
Yes. Call now if you haven't already.
And then if you have
It's the start of the
I've got a
year.
good one.
Okay.
Even if you're not having a Pap test, you still need to have a yearly exam and get a pelvic exam.
Okay.
Just because you're not getting a Pap doesn't mean it's not important to come in, because things can still happen and change
for sure
on those off years. And a lot of times we can't examine our own selves and know what's been changing. So it's good. I have some people who, use mirrors, they examine, they know what's going on, but not everyone.
Have you heard of the self-papping?
I've heard a little bit, but I don't know a lot about it. I can't talk about that.
Me neither. But I've heard about it, and I
can't imagine that it could be that accurate, but I don't know.
Well, listen, I have just paid a whole bunch of money to get my master's degree to learn.
Able to do it.
Yeah, and I've had to practice. I've had 800 hours of practice putting the speculum in, collecting that Pap correctly, and still sometimes we'll collect a Pap and then the lab will send it back and be like, oh, we didn't get any cells.
Yeah. Don't be afraid if that happens too. Sometimes Paps can be unsatisfactory and we call you about that. That doesn't mean something is inherently wrong. If you come in and you're having heavy bleeding when you're supposed to have your Pap test done, sometimes they can't see the cells through the blood under the microscope. So then they can't tell what's there because they can't see. So sometimes that's why you could have to come back. Or for some reason, I don't know why, there might not have been enough cell collection. We do our little brush and sweep and stuff, but it doesn't mean like it's perfect every time. So sometimes people have to come back then too. We usually have people come back a couple months later.
I can't imagine just doing it at home.
How
just inaccurate that would be. But
try to get yourself in the position also to do that. That would be, I think it would be hard. Might be something to think about trying.
Well, I mean, coming from a person that does her own laser hair removal,
not me. She doesn't mean me, folks.
You got to do what you got to do. Okay. Maybe I could be challenged to try it. Maybe we'll ask some of the other providers how they feel about it and what they think, because I really don't know a lot about it. So maybe I'll do a little research on self-PAPs, where it is, because I'm slightly nervous that people are getting them online and then just not seeing their doctor, which
can be dangerous.
Which makes me nervous. Yeah. I mean, so really, truly, you paid a lot of money for your education. You have a lot of letters behind your name. Same. Like, I promise you, you can do it. I am, I'm here for you.
I'll take care of you. Yeah,
we'll
take good care of you. Everyone
everyone
here is super nice. Would be happy to answer any of your questions about Paps and things.
And anything.
Yeah. So don't be afraid.
Okay.
Well, I'm so glad that we had you on
you.
today, Marissa. Thank you.
And
we appreciate you. I know that you were a little nervous. She's our first provider on.
Yes.
So,
and
we'll see
you
after hours.